So, as anybody who has a degree in landscape architecture, background in that, architecture, architects. So, married to a landscape architect, or just married. Okay. So, my point is that I started working on. I went into landscape architecture as a way to design communities, because I thought that it's really the environment itself and the way places make you feel that was really the motivating thing. And I knew as an undergrad I couldn't conceive of getting a PhD. That was way too much time in school, and I just wanted to get a degree fast. So I went to landscape architecture, and that was a 6-year undergrad degree. But anyways, that was fast. But I liked the University of Arizona, and I was in no hurry. So the thing that really became apparent to me is that if you really want to influence the way communities are designed, which is what I'll be talking about today, you really need to be involved early in the process. And in urban planning is more set up to do that, so evolved in that direction. And just later on got interested in then health. About 1996 or 7 was when the U.S. Surgeon General's report came out on physical activity and health. And that was at the same time the Heart and Stroke Foundation of Canada also was looking at the connection. And it became apparent that all the recommendations to that point to be more physically active were to promote vigorous activity. Programmatic intervention, joining a gym, actually were very difficult and actually were very largely unsuccessful at the population level. So the idea was that people needed to be more active in walking, and as soon as people looked outside their door and said, well, you're telling me to go walk and there's not even a sidewalk. So it became really clear very quickly. So it was sort of the very beginning of that whole thing. And so now it's really wonderful to see how much interest there is in this. And I hope, because really what it is it's going to take a long time, but it is a movement. This is the beginning of a lot of education and awareness raising. And I look to you all, and most of you that are in public health, to lead that, because you have success. And I think social learning and a lot of the parts of public health, the cigarette anti-smoking campaign, there's been some successes, and I think you're better at this and have more credibility with the public when it comes to the well-being, because it's their health, than the design professions. So it's really an interesting partnership that's forming. So when I talk about the design of communities, this is the way I typically like to do it. This is using that landscape architecture background only because I never get to, just to draw nice pictures. So now we have basically land use and transportation. So land use is the arrangement of activities in the urban environment. What's really important about land use is it's not just how we design our communities, it's where growth goes. You can have a really nicely designed, walkable looking place out on the edge of a region in a green field, and it's going to mean that there's going to be a lot of time spent in cars. Health is impacted not only by how active we are, but what we breathe. In fact, we don't know yet what the relationship is depending on our age and so forth. It could be, for certain populations, that exposure to air pollution is even more important. So we don't want to have interventions that say, be active, be physically active, get out and walk in your very highly polluted community. And then, of course, there's the effect of exposure to risk, crime, accidents, and all of that. So we have a complicated set of issues on our hand. So transportation decisions determine how we move between these activities. And then our neighborhood, these interact and affect how active we are. And if we choose to walk, or if we choose to drive more, and that affects how active we are, and of course our health. And our health affects how, and so there's a feedback loop, and I've used this as an example. In Vancouver and elsewhere across the country, we're starting to understand that there's an enormous amount of cost. This is not a new concept at all, but the ways that we have been making transportation investment decisions. Now, how many in the room are in transportation? I understand there's a good bit. Excellent. All over on the right here. Clustered. It's interesting. I bet there's a sorting going on here. So we know that transportation decisions are often made based on what's called cost-benefit analysis, which is really looking at what's the best bang for the buck. How are we going to invest in a corridor? Are we going to widen the highway? Are we going to put transit? what makes the most sense for a variety of reasons. These are politically driven decisions. There's analysis and there's objective information, and that's weighed against politics and so forth, and you end up with some sort of a decision, usually a balance between the two. Usually, it depends on the circumstance. It often, as we're facing in Vancouver with the widening of the highway, Trans-Canada Highway, it's actually defiantly non-analytical and just purely political. Argued on the basis of movement of goods, but would be disastrous for what has become known as a very livable, sustainable region. So, you know, if you look at the health impacts of a massive highway widening campaign, you're looking at, I mean, it is not a mystery that when you build a lot of automobile capacity, you get automobile-oriented development. I don't think that most people don't understand that, and it is a curious argument to say that we're going to reduce greenhouse gas emissions and by adding capacity to the highway system. And the argument there is like saying, as I was recently quoted, that most people get that you don't reduce consumption of a commodity by increasing the supply of it. You know, and so, but that's where we're at. So these are very, you know, they say, well, we'll free up congestion, and then there'll be less emissions. But then, of course, we're just going to ignore the fact that that facilitates an incredible amount of development to occur in a certain way, and then you're locked in. And then there's all the health impacts of that. So we are hand in hand tied with environment. When we talk about health, it's not just environmental health, it's actually the environment, climate change, air pollution. All of that is tied together, water quality. All these things are now integrated when we start talking about our own personal health. So risky lifestyles, costs, so forth, there's a number being put on this, and this is just from being inactive. Now, there's this thing called the energy balance equation, which you know, many of you, which is what we eat and what we burn up. And we have managed, and that affects our body weight, and we have managed to increase this and decrease this so that we are rapidly becoming heavier. And so here's, and you probably, many have seen this, but some of you have not. And this is the obesity rates per province in 1985, a little hard to read. And you can see that at that point, there was no data up in the territories up here, but you can see less than 10% in 1985 of the population were obese. By 1994, 9 years later, we're looking at 15 to 19%, a significant increase. And Alberta here, you were 10 to 14%, but you know these, you know, we're sort of looking at increases significant, and still no data. And then comes the data in 2000. This got measured in the most sedentary places in the wintertime, I guess. Really, we just have, and also there's dealing with ethnicity and so forth. So very concerned, heavy risk, and you can see still increasing rates. So we're rapidly increasing the rate, and then by 2004, and Dr. Kim Rain is here at University of Alberta as the one who gave me these slides, and I credit her for them, and a lot of people are using these slides and have similar data, and we can just see, but the bottom line is that we're getting heavy quick. So in a very short period of time, and the message is, for thousands of years, we were in balance, energy in and energy out. And recently, only in the last 30 years, this has been really thrown out of whack. And if you look at where this is heading, from a cost perspective, we can no longer ignore it. And people in public health, you know that. And so it's going to become imperative that we have more active communities. Now, what we've been doing is measuring in different neighborhoods, and I've done this a lot in the US, and I have my color scheme reversed. So the darker, the redder places are actually the most walkable. I was told to reverse that because you got to go green, right? So make it all red and then show the green. But I think it actually reads better this way. And you can see, you can just see a few nodes that are more walkable. But we map, and we're starting to do, and I think John Spence has been doing this here in your region in Edmonton. And you can see, but basically here in Vancouver, the increases in walkability. My student got that backwards. Anyways, this is more walkable, and you can just see so just stick with me. Ignore that. It's new stuff, but you can see basically downtown Vancouver, what we do is we build our measures for every single postal code. So a postal code is very small. It's a block face. So we have the tools to do this. So we match the postal code data with the census data. And so we end up with, so what that is a ready-made surface that you can drop any behavioral database on. It can be a travel survey, which is what I tend to do, but it can also be the CCHS, a Canadian Community Health Survey, which is what we're starting to do, or any other data set, because we already have our ready-made predictors of walkability, and I'll go into what those are in a minute. But we combine them all to predict the likelihood somebody will be physically active and walk, take public transportation, and have access to things other than by car. These are different cities in the Vancouver region, and we've arrayed them according to their level of walkability. These are some examples of what a place looks like that's the most walkable. It's a high-density urban center in downtown Vancouver. Here, it's a suburban mixed residential, single-family, multi-family corridor. This is probably like White Avenue. I would estimate that White Avenue would be right about there, maybe a little less walkable, not quite as dense as that part of Vancouver and Kitsilano, those of you who are familiar. And here we have in Surrey, so this is a typical suburban neighborhood, but sort of a mixture. It's got a little more density. It's got some commercial, so it's not as unwalkable as that, okay, along a highway interchange, what's around it. So you can see what becomes meaningful is that you can begin to use this information to make some decisions. So if you wanted to know where in Edmonton are we likely to have the most problems and where should we be looking for places to invest to meet the needs of the most at-risk populations, here's seniors, of elderly. Well, elderly are actually older, so we can see this term actually implies over 80, over 75, technically, at least the way I've learned it. But we're using it here just to say, really, seniors. And you can see this is where we've overlaid the elderly with, or seniors really, with lack of walkability. So these are seniors that can't walk. Where are they located? We care about that. This is a population that has less of the ability to drive, wants to be self-reliant, needs to be self-reliant from a psychological perspective, and being physically active can delay and increase quality of life for a lot longer and reduce cost as well. So that's seniors, and here's youth. So here you see, now in Vancouver there are a lot of kids, but it's walkable. So you don't see the overlay, but here in Surrey, a good bit of youth who live in Surrey can't walk anywhere. So that means dependence on the parents to drive them places. There's a whole lot of family. So when we look at the travel survey data, we see a lot of driving and a lot of trips that are non-work related that are to move the kids around. And that would not be necessary in this kind of an environment. Now we know that intuitively, but we've never really added up what the cost of that might be. So back to my point is that we need to be thinking about how the environment and transportation and health interact, and where are the win-win-wins now? What can we do that's actually going to be the best? And I believe the most important thing we can do now is the health sector and the environment sector really need to partner, should be having a lot of dialogue, because they have common objectives now, and they need to basically say to the transportation sector, enough. We need to tip the scales and start to move the money over to transit and pedestrian connections in our communities and invest in existing neighborhoods as opposed to expanding outwardly. This is critical if we're going to even come close to being able to reduce our greenhouse gas emissions by 80%. How are we ever going to do that with a doubling of population, which means that each of us will only be able to pollute theoretically or use 1/10 the amount of energy that we do today 30 years from now? How's that even going to happen at all if we don't create more walkable, sustainable communities? So the argument goes hand in hand. This is, anybody recognize that, what is it? Absolutely. It's the Pont du Gard. It's right near Avignon and near Nîmes. And it is it's an aqueduct set at 0.5%. I use it as a symbol of that planning and health need to unite and do it in a way that lasts. This bridge will be here long after what we're building today. And the point is that, we're in a significant period of change. So on the left brain, this was how I think both left-right brain. The left brain linear model is what we spend affects our costs. We have externalized these things, these outcomes, largely from the decision-making process to get near-term gains for economic development, real estate valuation in certain areas of our regions, and transportation is a way to spur economic development. In fact, often policies were actually, until recently, overtly stating that this is the way to stimulate economic development is through highway investment. I believe this province and this region would be a good example of that. Maybe Calgary even more. This is an energy-based economy, so this is a big concern because what will economic restructuring is a very difficult thing to do. So we have to be thinking long-term of how this is going to shape the future. It's probably a more difficult concept here than even thinking about in BC because of the nature of the economic base. But there are other ways to do things, and I think we're starting to look at them. So I'm going to just jump ahead. I mentioned this already. So in aggregate, the current evidence base, you say, well, what do we really know? We know that there is an association, that people living in those more walkable communities, the redder dots on the maps I just showed you in Vancouver, and the rest of Canada and in the United States, walk more, drive less, and weigh less. We don't know what they eat yet. We haven't studied the diet connection, but we're getting there. And we can say that there is an association between community design and health, environmental and energy indicators. As walkability increases, and we measure it based on mixed use, which is having shops and services near where we live and where we work, even having where we live and work perhaps nearby, connected. That's more difficult, but we can do that. Connected streets, having a connected grid, meaning we can walk a direct path between destinations. So there's two concepts. Proximity, which is how far we need to go to travel between where we live, work, and play. How far is it as a crow flies? And then the connectivity is how directly can we travel there. We've got plenty of places that it's just a stone's throw into the backside of a shopping mall, and yet we got how many people live where they can even see or could walk, are only within a very short distance geographically to a commercial destination, but can't get there, they have to drive. Anybody? They have to go all the way around. Only one? Well then, there's no problem here. I'm done. You've done all your work. How many live on a cul-de-sac in a cul-de-sac environment? Right, very common. But there's not even any uses anywhere nearby, no commercial destinations anywhere nearby that would be walkable even if there was a direct path. Mostly that. So here what we've done is we've separated the uses very effectively and also created more disconnected streets in general. It sounds like most of you actually live on a more connected street grid and maybe do have shops and services. How many can walk to a store near their house? Wow. That's very unusual. Is that typical for Edmonton? Self-selection at its best. Okay. So I can talk all I want about the gateway and my opinion about it. All right. Okay. So anyways, as walkability increases, so we know that, but we also know as walkability increases, obesity decreases, and so does per capita vehicle use and associated air pollution, all that. However, we don't have causation proven. We don't know exactly if it's our behavior, if our behavior is being affected by the environment or by our preferences for different types of travel patterns. We are each predisposed to wanting to walk more or less, being physically active or not. And that's going to affect the kind of neighborhoods that we choose to live in. So we could be walkers and we'll walk more anywhere, or drivers and we're going to drive more wherever we go. Okay? So we don't, that's the argument. But we now have started to unravel that. From a research design perspective, what we actually have to do is capture both people's preferences and measure their behavior and the environments in which they live. And we've done that. And I'll present that now. And that's new. But basically, there's a lot of studies showing this association. And we can control for demographics, so we know what that means is for people with similar incomes and educational attainment, gender, ethnicity, all of that, that they actually behave differently in different settings. More walkable begets more walking, that's why we call it that, and so forth. Let's not forget the transit piece, that you cannot have a walkable community or a region that supports pedestrian activity and active transportation and reduces automobile dependence without public transportation. They go hand in hand. And they should be actually spoken about, I think, as a mode. A single mode in a way, because if I asked you how you got to work and you said transit, I would ask you, did you walk to the bus or train? Yes. Well, chances are you got enough physical activity from just walking to and from from transit on the way to and from work to get that minimum amount of moderate physical activity you need to be less likely to develop a chronic disease. That alone is an important point, and I have a student who's proving that right now with his research. So we self-select our neighborhoods based on our preferences, but new evidence suggests that the built environment also influences travel and health. That basically when you control for the out. Now so what we've done is we've compared people who live in different neighborhoods. So here's a house in a more automobile-oriented cul-de-sac neighborhood. And here's one in a more walkable neighborhood, and you can see these are the different types of land uses. Here it's all single use, so that may be characterizing those who live in a more cul-de-sac environment. There may be a park or something nearby, green space. So this is a 1 kilometer distance, but if you look at the shape of this, it's a function of the street network. So you could have a lot of stuff right over here. Let's say this was commercial, but if you can't get to it, it's not going to affect your behavior. Now, the research that you've seen in the press, a lot of it, not only would it include this area, it would include maybe a much larger area or an entire jurisdiction. It's just averaged across, so it's taking average densities across an entire region, for example, and then comparing it to other regions, saying that Edmonton is, on average, more densely populated than Calgary, let's say. Very coarse analysis. Much different than saying, well, here's a household and here's what they can get to. Here's a household and here's what they can get to. They can get to more. This is a 1 kilometer crowfly buffer, airline, and here's the network. And here's the distances when you have a disconnected versus a connected grid. It's twice as much, about. So this means that this is a walkable distance and this is not. And this just shows you have to go out to the main road and back over here just to get from here to here. Unless there's a path, which is that's the idea of sort of retrofit, is what are we going to do about this, right? Well, the first thing that we can do is start to build some easements for pedestrian connections in existing neighborhoods. That is really a high priority. From a fiscal perspective, that is probably a lot cheaper than rebuilding our neighborhoods. So pathways could be a way to go. We've looked into this in the past. You know, we are aware of this as a society, that pathways without needing to drive could be a real answer to this. If this is all retail along here, and all these people live here, 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 and here, a little easement through to the store could make a big difference, because what you do then, from a travel behavior perspective, which is grounded in microeconomic theory, basically saying we make choices that are the most with the highest utility, the greatest benefit. When we walk into the store and we want to buy toothpaste, we could say, well, I've been using Colgate for 20 years, but my God, Crest's price was it's on sale. So I'm going to try Crest. It's a discrete choice. It's consumer behavior. Walk, bike, drive, transit, those are discrete choices. And we say, well, right now, you got to walk around or you drive around. But if the pathway is created, meaning that you just have to go right here, it's a short distance, it's faster to walk than to drive, how many people think they would actually change their behavior? Very fast, right? So basically, that's a way to encourage, let's keep the cul-de-sac there, keep the pass-through traffic, which is why we don't want to live on a cul-de-sac, we don't want that traffic, and allow people to walk through. Well, there's a lot of reason why people don't like that, because that takes away that protection, that ownership of that space. It allows people into the neighborhood who they may not want. So that's a little bit of loss of control, but the gain is that for the greater good for public health could be quite significant, and for the environment. So this is another region. This is Seattle, and this is looking at walkability in that region. Darker's more walkable, where it's mixed, it's dense, there's a connected street grid, and the amount of retail in the neighborhood is increased. Here's a household that lives on Queen Anne Hill, which is a neighborhood in Seattle that's very walkable. And you can see that, and it's a fairly round buffer and that's because the street grid is connected. And here's where this person works along the water downtown. This is the shortest path alignment for their trip to work. And we've measured this and looked at, well, okay, so changing the environment is kind of tough to do. It's already built. That's the biggest problem. We always get that answer back. There are reasons to believe that it's actually not, it's just we're very short-sighted and it has to do with the political process. But every 20 to 30 years, we really recycle or change most of what's on the ground 30 years from now will have been built or impacted from today forward. We all remember, or many of us remember, the energy crisis in the 70s. The argument was, let's not change the physical environment, that takes too long. But most of what's on the ground now has been built since then. If we had done what we needed to do then, we wouldn't have the problems that we do today. So, but we are a society that thinks more short term. So let's say a modest increase in walkability, we get a significant jump in the percentage increase in minutes of walking and biking. That's because there's very little walking and biking going on anyways. It's easy to get a 100% increase to go from 1 to 2. So, so this is a modest increase, don't be so fooled. A quarter point reduction in body mass index, about a half a kilogram. 6.5% reduction in vehicle miles or kilometers traveled. That's significant. That's actually, we look at that number and go, that's kind of low, but that could be the difference in actually a lot of congestion reduction or distances driven particularly, but congestion is a little different. And about a 5.5% reduction in ozone precursors. So this is the air pollution. Oxides of nitrogen and volatile organic compounds. Now, what we do know is that over a 2-day period, the likelihood or odds of someone reporting a walk trip increased by 20% in our study in Seattle for each additional park in that little buffer. So that's a significant jump. And also increased by about the same amount for each additional education. So having destinations, the bottom line, really matters. Those of you who do not have anywhere to walk to other than to other residential dwellings have less incentive to walk in your neighborhood. Now, this is the air pollution piece, so I'll beg your forgiveness on having to, so early in the morning, think this hard, but I'll say that this is more intersection density. So what this is connectivity. This is a connected street grid here, and this is a cul-de-sac over here, and it's a continuum left to right. And what we do is we measure the numbers of cul-de-sacs per square kilometer. The number of intersections. So a connected grid has got a dense number of intersections, and you can make a direct pathway. And what we see is air pollution, as you'd expect, goes down. So this is controlling for a lot of factors, and you can see that's where we live. So having a connected grid where we live, and many of you do, that's associated with a lot less air pollution or significant reduction in air pollution. And where we work, we see the thing that matters most is working in a neighborhood that has retail that is not surrounded by a lot of parking. That's where the FSR, urban planners, how many urban planners are in the audience? Now I understand you're now ramping up an urban planning program here, so this is good. I'll be able to hopefully come back one day and I'll have as many planners as transportation people. So here you see the reduction in emissions at work seems to be for those of us who work in places where there is a lot of retail and it's actually built up to the curb. So a word of caution, this is the point I made earlier, is that concentrating development in more compact areas can lead to increased exposure. What we have is a bit of a dichotomy. We've got, yes, if you live in more walkable places, you drive less, so you generate less air pollution, and the overall regional air pollution is better. But remember, air pollution exposure and concentrations of air pollution vary across the surface of a region. So we have to be very careful because we remember fleeing the central city to move out to the suburbs because we wanted to get away from all the air pollution. So it's not like we say, oh, I can go back now. Well, it's actually still there. You know, the air pollution is still concentrated. Certain types of air pollution, particulates and carbon monoxide, are in small areas and concentrated. Those are hot spots. Ozone is regional. So a lot of people living out in the suburbs, and specifically those to the probably the prevailing winds are from the west here, to the eastern side of this region are actually exposed to more ozone than those in the downtown. And I bet your sensors would show this. So it's a secondary pollutant. We, in the morning, go to work. We release all this oxides of nitrogen, volatile organic compounds or hydrocarbons, and they interact in the sunlight by noon, and then in the afternoon the ozone's off the charts. And that's happening in the summertime, and typically it's a secondary pollutant. So there's a bit of a disconnect. Now that speaks to the argument of, more compact is good, but with the particulates, it's a very serious issue with heart attack in elderly is that exposure to particulates. We're just learning now. The science is very quickly demonstrating that exposure to air pollution is a very significant problem and for seniors and for youth as well. So we have to watch that. That doesn't mean that we can't have walkability and reduce exposure to air pollution. We have to have cleaner cars. We have to keep the truck movement away from where the high concentrations of people are. We need to look at where we're siting assisted living facilities for the elderly. And we need to make sure our schools aren't near highways and freeways. There's things that we can do. And then along major transportation corridors, we should stagger back the high-density residential a block. So that even 100 feet away from the roadway edge reduces a lot of that exposure to air pollution. But to be walkable, we can still walk 100 feet or 200 or 300 feet, we hope. Now, so that's the way that it can be done. So this will get twisted and be used in other ways for political purposes, but the fact of the matter is the two can be accomplished in a mutual way, but if we're not careful, we could solve one problem and increase another. So, so I just wanted to mention, I'll just say what this slide says, is that distance to transit really matters. Our likelihood of using it declines significantly based on how far we have to go to get to it, and how far we have to go when we get off it. And if we have transfers and a relative travel time via transit versus highway is enormous. In a region like this, it's irrational often to use public transportation. It would take you another, fourfold of time. I know when I lived in Atlanta and I lived fairly close to a rail station and I worked fairly close to one, the travel time was 1 hour and 10 minutes. I could drive to work in 15. And I do this for a living. Do you think I took transit? No, not at all. I would have never gotten anything done. I wouldn't have had this project. I would have taken transit to work. So we make rational decisions, and we have to remember that. So here's some evidence about Atlanta. This is a study known as Smart Track, which I coined where the Clean Air Act meets the obesity epidemic in the U.S. So the U.S. has a strong federal role in transportation funding that we don't have here in Canada. And it was because of that strong federal role in transportation that George Bush Sr. signed into law the Clean Air Act amendments in 1991. An extremely progressive piece of legislation. This is George Bush Sr. And we had funding to do a travel survey to incorporate all these pieces that I lecture about quite a bit. We asked people, though, not only did we want to know their travel patterns, we asked them, why did you choose to live here? What are the factors that are important? What were the trade-offs that you made? How's your decision-making process work? We kind of learn at that point that we discount the lifestyle, the community that comes with the house, and we fall in love with the granite countertop. The tangibles, the visible, the thing, the product, the house, the size of the house, the yard, all that stuff. We think we're going to use a green space that may be across the street. It becomes another subdivision. We're mad about it. My friend, a brilliant colleague of mine, Christopher Lineberger, who's with the Brookings Institution, says that when you add development to a sprawling subdivision, the quality of that place goes down. More investment, more sprawl is worse. The roads fill up, and it's a disaster, and no one likes that. Think about a walkable community. The more you add to it, the better it gets. The more services, the more shops, the more destinations, the more people, the more ability to support those services, shops, destinations, parks. That's why downtown Vancouver is so successful, because it spirals up, whereas the automobile dependent spirals down. And I think that's a very interesting concept we need to be thinking about. So this is a land use database, so we had to know where growth was going. And also, I mentioned that earlier, that's like the walkability, and we asked some questions on physical activity. The reason I mention this is that this is a perfect region for this kind of a study to happen, where there could be a partnership between transportation and health. Of course, I get to say this. I'm from out of town. I just leave all. But the idea is that you have travel surveys that you do here periodically. When you update the travel survey in this region next time, there could be a list of questions in that travel survey, could be a couple pages, that would allow public health to be able to use all that information. And the pedestrian travel, walking, all that could be captured. A lot of it is captured, depending on how you're doing it. And that can enable this kind of research to happen here. It could cost no more than what you're currently doing, or modest amount. And in fact, that data collection effort could be shared and costed between health and transportation. And that really unites the professions over what's going on and how decisions are being made in this region. That's what we tried to do in Atlanta. Atlanta's only did it because they were being forced to do it by the federal government. This was a form of mitigation, this project. That was what they told the federal government. We're going to study it. Leave us alone. We'll study it. And as soon as we came out with all our reports, and I'm glad this is being filmed, they never released them. They never released the reports. It's been 2 years, and I'm starting to get pretty upset about it. 2 years that region has ignored the findings from the research. $4.6 million of taxpayer money, and they won't release the reports. And then we went and wrote a synthesis report, which is getting shared, and it's being used all over. It's being circulated around the world. But the region it was done in is blind to it, doesn't want to hear it. I was told, you're making the suburbs look bad. We don't like it. So that's Atlanta. They don't want to, this is not something that politicians there are taking very kindly to, because I'm demonstrating that the kind of development decisions they're making, the kind of transportation investment decisions they're making, are counter to people's health, counter to their well-being, counter to their economy in the future, because they're going to be very uncompetitive for future growth and development. As energy costs spike, it's going to cost more to do business in a place that's auto-dependent. Remember that. It doesn't play out yet, but as business make the location decisions, they're going to care. Of course they care. Their bottom line. So if it's going to cost 3 times as much or whatever to do business in an auto-dependent region versus one that's more sustainable and walkable, think about the kind of decisions people will make. A lot of industry is very footloose now. So this is an observation-specific buffer in Atlanta in a walkable neighborhood. And I use this slide to point out to you, here's a retail corridor. This is Ponce de Leon. There's a lot of commercial. And you can see these lots are narrow and deep, like you have along the neighborhoods that I was on White Avenue. Now, why would a lot be narrow and deep? Built in the 20s. Because you can walk to the store. Because it's only a short, if these were narrow and wide, then you would have a very long distance. Everybody, you'd have, I don't even know what that would look like. But anyways, this is how we always built our communities, and it's because we always had to walk. So we know how to do this. It's everything we always did. And here's Atlanta. Now Atlanta's 60 miles across and about 110 miles north to south. It grew the fastest. It was the fastest growing settlement pattern in the 90s, believed to be in the history of the planet in outward growth. And now it's about 5 million people. And Ted Turner said, and I thought it was quite interesting, and he was the first funder of my research in Atlanta, thank God for the Pacific Ocean, because at least there's something to stop Atlanta's sprawl. So then I moved to the Pacific Ocean, and I was going back all the time to do work, and I thought, you know what, it's not even far enough, right? I'm still in the commuter shed of Atlanta. So anyways, I'll just show you, this is a model that we did on obesity that showed that driving is a predictor of obesity. And what we see is, you don't have to know the numbers, but as a red arrow up means more likely to be obese, and a blue arrow down means less. So age, the older we are, likelihood of obesity increases to a point, to about 65 years old, and then it returns, actually goes back down. But for most of the population in our survey, which was 93% of our sample, we're along the increasing part of the curve. And you can see that education, income, and how far we walk reduces the likelihood of obesity. But how much time we spend in a car is positively and significantly associated with obesity. So that's a very important connection. It was the first time that was ever shown. Now, why might that be? It's kind of intuitive. But this is active, and this is sedentary. So if that's the case with the 90 or so minutes we spend per day driving, think about what it might be for how much time we spend in our homes, or what we're doing on the job. Now that hasn't been measured as carefully yet, but it could be, and I think someone probably is starting to do that. I know there was a study by Roland Sturm that showed from Rand Corporation this similar relationship about how kids are spending their time in homes. Now mixed use, this is having shops and services nearby. What this means, the more shops and services you have near where you live, the less likely you are to be obese. Now in a model like this, we typically have something called our referent group. This was white males, so we compare and say a black male and female is more likely to be obese, and a white female is much, much less likely to be obese than a white male. Now there are some numbers over here that show the differences. These things that are flat out zeros are the strongest, but everything in this model is greater than 0.05, which is the 95% confidence level. So it's very significant, all the relationships. And what you see basically is different ones are stronger. And a white female being so much less is actually, we believe the reason this is so strong is that white females underreported their weight. But we have no reason to believe that that white women in Sprawl are more likely to underreport their weight than white women in walkable in-town neighborhoods. Now, I don't know, maybe we're wrong, and maybe there's part of that walkable vanity thing that I live in a walkable neighborhood, so maybe there's some systematic bias, I'm not sure. But I was also told that men overreport their height. Now, I can't imagine a thing like that. All right. So, anyways, we have each additional half hour in a car is associated, so these numbers have been kicked around quite a bit, but a half hour in a car is about a 3% increase in the likelihood of obesity, and everybody says, well, that's a yawn, that's not so much, right? Well, there's a lot of half hours in cars each day, hours and hours in cars, so you get some pretty significant effects, and we're starting to see that in the sample. And then we see each kilometer is about a 5% reduction that you walk in obesity. So, washed across the population, this matters. Now, forget all the modeling and all that. You can just take the mixed use variable and say, here's the most mixed places, and here's the least. So that extreme example I showed you of the cul-de-sac versus the walkable. And you see about a 10-pound difference for those in the most walkable versus least walkable parts of the region. So a white male, it seems to be that white men, their weight tracks the most with walkability, their behavior does, and so there's probably a lot of interesting research that needs to be done on that effect. Now this is what came out in the Washington Post when this article was done, and it basically driving causes obesity, the more you drive the bigger you get study. And I had to look at that picture myself for a minute to figure out what that was. And I was like, oh, that's a guy's head. Okay, perhaps it's time to redefine fossil fuels as a carb. I guess that's more timely now than it was even then. So I thought about, and this is the cultural aspect of this, is that the questions that were coming from the press at this time were, what are we going to do to get more physical activity while we're driving? So it's just, we are so ingrained into the car culture now that we can't see out of it. It seems irrational and ludicrous to even propose that we're going to have to change our behavior. Now remember, we changed our behavior into the car, so the idea of starting to divorce, not divorce, but to start to wean off it a little bit meets with tremendous frustration. That's a huge problem, difficult for people to get their head around. So I thought about the Flintstones, who actively pedal themselves around. So physical activity is also an important message, and probably from a policy intervention perspective, a more positive note, because it's what we actually need to do. One of the things we need to do, diet as well. We found in Atlanta, we measured with like this, an activity monitor, a little smaller, over a 2-day period, and your researchers here, John Spence, use them as well, accelerometers. So basically, the idea is to measure physical activity in an self-reported data is largely useless. It's relatively useless compared to objective information. So what we have to do is really try to get the real information, and we do that, and we find out that people in Atlanta in the most walkable areas are 2.4 times more likely to meet the 30 minutes of moderate activity per day. About twice as many in the most walkable, but only just over a third. In the best case scenario, a third of the region gets 30 minutes of moderate activity a day. So we're completely sedentary, essentially. But the differences exist across, from one sedentary level to another. And this is more recent on youth. And so I don't know how well you can see this in the back. Can you read that, 5 to 8-year-olds? Okay, 9 to 11, 12 to 15, and 16 and older. So the columns are age groups, and the rows are land use variables. So what we did was we're basically in a matrix looking at the relationship between whether or not a kid reported they walked, admittedly self-report, over a 2-day period in a travel survey, based on the neighborhood in which they live, that 1 kilometer buffer. Do they live in a connected street grid or cul-de-sac? Do they live in a denser residential environment with mixed use? Do they have at least one commercial destination and a park? For 5 to 8-year-olds, the park. Only thing that really mattered. That makes sense. To a 5 to 8-year-old, that's going to really be the thing they would walk to. Probably escorted. And then 9 to 11, residential density, that's because distance to school. Schools in denser neighborhoods are shorter distances to the school. 12 to 15, the whole point of the graph is really right here, is that when we're old enough to be independent and out and about, but not quite yet old enough to drive, we're very sensitive to the environment. I think this is a really interesting result, is that everything matters to the 12 to 15-year-old, probably more than that's on this chart, if I remember correctly. Certainly liked going to concerts at that point. There's not that we should have rock concerts. And then 16 to 20, oh my God, what happened? It all drops back off. So you can see that once you're able to drive, then we lose that built environment sensitivity. These are good sample sizes for these narrow age groups. You're looking at high numbers. The beauty of this survey is it was so big. It was so much data. So you can see that, and you start to see these relationships. Very interesting. And we see, and I think this is something from a policy perspective I always like to remember to say, is that changing the environment is hard to do, and it's going to take time. But we could change very quickly the price structure for automobile insurance. For example, the same kids that lived in households that had 2 versus 3, or 1 versus 3 vehicles were much more likely to walk. So if we want to encourage kids walking, one of the ways to do it is to reduce access to cars. Not so complicated in theory, but it might mean changing your household structure a bit. Or the way decisions are made. Now, there could be incentives for that to happen. For example, right now, each additional car is actually cheaper to add to your insurance policy. Now, that from a behavioral and environmental and a whole bunch of other perspectives is reversed. So we should make each additional car exponentially much more money. That's the first thing we need to do if we want to change behavior. If we don't want to change behavior and we just like our lifestyle, then we don't want to do that, right? But we've been doing that really well so far, and it looks like we're heading right at a wall. So heading at a wall is kind of a problem. So some of you might look at that and go, well, that's a terrible idea. Now, here's another terrible idea. What if we moved our insurance from a sunk cost, everybody pay their insurance at the beginning of the year, or whatever time, once a year, you just pay it all, right? Or half of it or a quarter of it, whatever. But it's done. It's fixed. No matter how much you drive, your insurance is the same. Now, what if we move to a system that said, because the more we drive, the more likely we are to have an accident, the more we drive, the more air pollution we have. Why not say the more you drive, the more you pay? You don't drive, you don't pay. Why should I be paying insurance? I barely drive. That's unfair to me. So for people who actually need access to a car, who are poor, that might be a way to allow them to enter into the driving, be able to drive. And having access to a car is really important. To a senior, they may not drive so far. They just need to be able to drive to a certain distance to the store or something. So this is I think this distance-based insurance is one of the first things that we could do to actually address this kind of thing. It's not going to take a long time. It's a political decision. Implementing it would take a week. Those are the kind of things. It's congestion pricing during the peak hour. Those things don't take years to build. They don't take a decade like building a bridge. Those are things that happen, and they happen fast. You just need the political will. This is the time, as all our elected officials are saying, I'm green, I care about the environment. You say, show me. Here's an idea, and see if they do it. So there's a little bit I wanted to mention on the energy balance side. I'm running out of time. Dr. Spence is now standing. That's an indication that I'm running over. So, but basically, calories in versus, I mentioned this. So we've been looking at this relationship. So one of the things that you can do with a travel survey that hasn't been done before is that we don't just know where people go to work, and we know where they go for food. So if they go to restaurants or fast food outlets or grocery stores, we know that. So we started correlating that to compare the physical activity. Now this is more information than you need, but you'll get it anyways. So if you want, or you cannot. But I'll just say this is, now in that obesity model I showed earlier, it was the whole sample grouped together, except I compared men and women at the end, black and white, okay? A little bit, but it was the pooled sample of 11,000 people, that other model. Now this is breaking it apart and looking at body mass index. So this is not obesity. This is a range, a continuum of healthy body weight or not. So what we see is, and I'm going to just skip these are the demographic factors, and just point out that walkability, where people live, how walkable it is where you live, matters for men, but not for women. We would never know that before. But when you break the sample apart, you start to see, well, what's going on? So what's happening is that how physically active body weight for men tracks with the walkability of their neighborhood, but for women not. It could be because of perception of crime, because the more walkable places in this region, Atlanta, where the study was done, are actually ridden with, a lot of it's ridden with crime. So that may be that's the difference. So we need to understand a lot of complexities to this. You can create more walkable communities if you don't mitigate crime. You're not going to get behavioral change. So those are the kind of things. That could be the answer, but we don't know. And here, look, at eating at a fast food restaurant or shopping at a grocery store, that seems to matter for women. Doesn't matter for men. The reason I know that is when it's 0.05 or lower, it's significant. So that's the significance level. So I'm just interpreting this. So this is 99.9% significant. You subtract from 100, and this is 99% significant. So, and this is, 43% significant. So that's not going to do it for us. Block 4, physical activity matters for men and women. And so you can see some differences. And then we look at, and the politically correct way in Atlanta to talk about ethnicity is black and white now. And we can see that for where walkability matters is for whites, doesn't seem to be significant in explaining body mass index for black. Now, I pointed this out in the first paper, that the demographic differences, that we did not see significant differences in obesity or in body mass index for blacks, and we did for whites. So it's following the same results, but basically the press, and when we released the results, I wanted to express that, and it was thought, too much information, we get the main point across, the population, but if you're talking about a neighborhood in a minority context, you need to understand these are different people. If it's largely seniors or elderly, that's a different situation. So high concentration of kids, again, different situation. We can make a lot of wrong, uninformed decisions by not looking at the details. So, and then variance explained, you can see for whites and blacks, for eating at a fast food restaurant was a significant predictor of body mass index in white, and shopping at a grocery store really mattered for black. And then, we see some other, the physical activity again mattered for both groups. So we're looking at food environments, and I'm going to just jump ahead and just say that we really have to be careful about this causation piece as well, because it's not just the neighborhood you choose to live in, this is where you live. So you live in a walkable or an unwalkable neighborhood. Is it mixed, dense, and got a connected street grid? Is there public transportation nearby? That would be over here. If it's more automobile dependent and probably more towards the region's edge, it's over here, and it's a continuum, and here's what you prefer. Prefer a walkable environment and prefer an automobile oriented. So we don't all live in the neighborhood we prefer. Not everybody's perfectly matched between their preference and their choice. Preference, choice. I want to live in a walkable neighborhood and I don't. I want to live in a walkable neighborhood and I do. I don't want to live in a walkable neighborhood and I don't. And I live in a walkable neighborhood and I don't want to. Okay? All four. right? And so you can see, and we've actually arrayed our sample from that study along these 4 quadrants. And you can see, and then we've looked at the results. And what we see is people with similar preferences do behave differently in different environments. How many of you can remember taking different types of making different travel choices in different places you've lived? Right. Of course, it's like anything else. It's like going into a store to buy something. You just make a decision given your choices. So why would we not make different decisions in different environments that give us different trade-offs? And so that's what we're learning. So that's the kind of research, though, and I do a lot of work for elected officials and people who are political, and the more visionary ones I work with always say, I can't believe we have to prove this. So this is interesting. We're starting to learn dissecting this. And obesity, this is that for the folks that are in these 2 quadrants here, the I don't want to be in a walkable neighborhood quadrant, there's no relationship between the environment and their body weight at all. It came in like to the 100th decimal the same. Zip. No difference, right? And why is that? They're not going to change their behavior in terms of walking and physical activity very much. That's not what they want to do. So this is more or less, that's the case. But for these folks, it makes a big difference. So a lot of people are not enabled. We've actually priced a lot of people who want to be in walkable neighborhoods out of them. It's because there's an unmet demand. We have, for a half a century, oversupplied, not oversupplied, but we've supplied more automobile dependent and undersupplied and made it difficult to build. In fact, zoning regulations make it illegal to build walkable communities in many places. So we're starting to see that this is the group where differences matter. And so kind of interesting. So in summary, changing land use, bringing residential, commercial, office, different uses closer together again. That means changing zoning, though, because it's illegal in most places to do that, and increasing the ability to travel directly. So the subdivision regulations, which control street network design, very important. This is a rapidly growing region here. You have a lot of new communities being built. So if you look at what's on the books in terms of regulations, it's probably cul-de-sac oriented networks, and that actually is, that would have to be changed. And then having recreational uses as part of it. You don't get density and people wanting to live in density without amenity. You have to invest. That's the government's role on the front end, is to provide that public realm so that people want to be there, and then the density will come. Transportation priorities, increasing funding for modes other than the car. We have done a spectacular job of underfunding these other modes. They've been decimal points compared to where our money's going. And if we think we're going to change behavior while expanding highways, it's not going to happen. We just got a paper accepted the other day that shows that if we reduce traffic congestion by 10%, we actually reduce walking and transit by about the amount that we hope to increase it by creating more walkable communities. So we go nowhere fast. And that's the reality. That's just objective data. It just shows the cross elasticity, and it's like the same story again. I went and bought Crest for the first time after using Colgate for 20 years because the price went down on Crest. So if in fact we add capacity and we reduce travel time and we make driving more viable, we're going to get more drivers. A lot of people don't drive because it takes too long. Congestion keeps us off the roads. It's just making decisions. As soon as you hear it and then you think, well, wow, that's, but that's how people make decisions. And we have to go with that. So direct linkages and focusing transportation investments in existing centers as opposed to newly developing areas. So has zoning become health adverse? Now there's a really interesting prospect here. 80 years ago, zoning was enabled by the provinces to the municipalities to improve our health, our safety, and our welfare. And we did that by separating smokestacks and factories from residential uses. And that was good. We needed to do that then. We have now translated that into a form of segregating land uses where we cannot walk. Yet we have this basic decision that the power to zone land, legal underpinning, is for health. So we could challenge zoning based on its being no longer health promoting and in fact health inhibiting. And I think that's where this research needs to be applied the most. It's a tough battle, but it's tractable and the evidence is on our side if we wanted to do that. If we don't do that, we'll never get anywhere. So that's essentially the way that the, unfortunately, world works. So next step, applying the research. I think I said a lot of this. Creating health impact assessment tools. We have in Canada on the books the need to do health impact assessments, I believe. In many contexts, we've never done them effectively that well. We've done them on the social side and on the qualitative side, very useful, but we never really measured the effects. And so the bottom line is the increases in healthcare costs warrant careful investigation into ways to proactively reduce the odds of morbidity and mortality at the population level. We can at minimum start to measure things so that we have tracking how walkable neighborhoods are, just mapping and measuring over time, and having indicators and looking at how are people traveling and how active are they in those places. And then what are the environmental consequences, the rates of obesity and all that, and then what's the quality of life, the perception of how well people like their neighborhood. So I thank you for your time and patience in getting going there, and look forward to your questions.
Larry, a lot of information for us to think about. We are having a panel discussion
of increasing or decreasing walkability in the downtown Vancouver, and I looked at that and say, "Ooh, yeah, concrete canyons." And then the least walkable one says, "Wow, lots of open green space."
Where are you going to walk to in the open green space? That was a highway interchange.
I'm going to walk to the park.
That wasn't a park.
It looked green, and that's supposed
green,
to be
right? No, and yeah.
I have just looking at the pictures.
Right, our measure, and you raise a good point, Jeff. The walkability, the way we've measured it so far is for utilitarian travel. We have not measured walkability for recreation or walking to, but it's in the data anyways. We know whether or not people walk. So in more mixed-use neighborhoods and older neighborhoods, there were a lot more pocket parks. We have sort of gotten around, sort of moved away from requiring developers to provide those destinations. There are more larger, probably regional parks, possibly, but not always.
Is that more segregation? Here's the park district way over here, you got to drive to the park.
Yeah. Well, that downtown Vancouver scene, only a block and a half away from that are some really big parks, and about a kilometer away is a 1,000 Stanley Park, right? And from most directions, you can go to the water's edge and have open space right there. So that amenity is inherent in that. But you're right. We have to be careful about making sure we provide open space. And another way to think about this is we asked people on our survey, we compared different neighborhood types, and we asked people, what neighborhood would you prefer to live in? And one woman, I'll never forget it, she said, this was a cul-de-sac neighborhood, and there was no sidewalks, and she said, this is where I prefer to live. And we said, why? And she says, well, that's walkable. And of course, because she said it's walkable because there's no pass-through traffic, there's no cars, and that's walkable to me. And that's important. That's important to know. We have built the neighborhoods we have for good reason. People like them for certain reasons, but we also know that there's an unmet demand for more walkable places in the way we define it, where you can actually accomplish something and be active at the same time. So there are some trade-offs, there's no question.
There's a microphone there if you want to.
That's okay. On the chart where you have the blacks and whites and the body mass index, you found that the blacks had a higher body mass index. Was socioeconomic status controlled for or not?
Yes, every single one of it was men and women and then black and white.
Yeah,
the top, I actually avoided going because I didn't have enough time. But every single chart has all the demographics.
Actually, not that one.
Age, race. Oh, the first.
On the first one.
Yeah, they're all there. Yeah, I went through them. Age, education, income.
So when you look at black male and black female versus white female, was socioeconomic status controlled for in those?
Has to be. It's already in the model.
Okay.
Yes, it's already there. Yes. There could be other factors we didn't look at, for sure. Perception of crime. Perceptual variables were not in there. Or preference for neighborhood type. Still, always room for improvement.
Okay, we'll take one more question and then we'll move on. So,
I just kind of a comment, maybe you could comment on it. One thing that I find is really interesting is that that is the only thing that gets people on transit and the only thing that gets them in other modes. If we make nice, comfortable roads, forget about it. It's
Totally.
easier, right?
Everything we've learned proves that.
Our politicians and everybody thinks that we need to have perfect roads, perfect transit, perfect everything. And I don't have to comment on that, but my intuition is that if we have an infinite array of equally perfect choices, there's nothing that really can stimulate this motion in the way that just a really bad traffic situation would be. So I've always used transit when I'm jammed in traffic.
Well, the reality is, and I said this in Atlanta, and everybody was like, well, you know, this is really, I said that congestion is the only growth management tool we have.
Yeah. I agree.
You know, but if you want to make a change, you have to sort of call it the way you know it is. And it's true, you know, but I'm sure there are people in this room that find that very, very horrifying. Oh well, it's the truth.